Hi everyone, and thank you for being a part of today's in-service. The focus of today will be on a contemporary issue that is impacting the nursing practice, compromising patient safety and the health of the workplace. And this issue is unreported sharps injuries. Today I will be firstly outlining what the problem is, why it is a problem, what's being done about the problem, and how we can help resolve this. Secondly, I'll be explaining the background of unreported sharps injuries, how this action goes against our legal and ethical scope as registered nurses, and what our responsibilities are as new graduate nurses in relation to this issue. And finally, with the use of research, guidelines and policies, I will conclude with explaining the importance of this presentation for our future nursing practice. A hazard is a source or situation with potential harm. Our example today can be referred to as a hazard in different ways. Simply using a sharp is a hazard. However, this goes further to when sharp injuries occur and are left unreported. New South Wales Health regards most sharps injuries as foreseeable workplace hazards and identifies them as being significant problems for all healthcare workers. As we know, sharps are currently used in hospitals in forms such as needles and medical instruments, and despite existing guidelines for safe practice and disposal, sharps injuries still continue to occur. Evidence shows a high level of sharps injuries, however, are unreported by staff, and this is a major problem. Reasons for not reporting injury range from workers deeming themselves as having a low risk of disease transmission, no time to report, fear approaching management, and the consequences on their career, as well as the complex reporting system. The World Health Organization defines patient safety as the absence of preventable harm to a patient during the process of healthcare. Unreported sharps injuries can risk patient safety in many ways, such as risking unknown transmission of blood diseases, compromising treatment, and potentially leading to further long-term and harmful health problems. The Australian Department of Health defines a healthy workplace as a workplace that supports and encourages healthy behaviours in its employees. Unreported sharps injuries can impact healthy workplaces by similarly placing nurses at risk of untreated disease and, additionally, leading to long-term emotional, psychological and financial consequences due to guilt, fear, the urgent testing, healthcare visits and potential long-term treatment. There are currently policies, guidelines and professions in place to form a foundation that we, as registered nurses, can access to diminish unreported sharps injuries in the workplace. This includes the Work, Health and Safety, Blood and Body Substances Guideline, which outlines the legal requirement for all New South Wales healthcare workers to be provided with necessary information and appropriate training, with mandatory systems in place and followed to report sharps injuries. There are also existing roles within the healthcare system, such as clinical leaders and infection control and prevention professionals, that provide leadership and advice in reporting sharps injuries. The purpose of this in-service is to change the attitude of not reporting sharps injuries. I remember working as an AIN and hearing registered nurses talk about a colleague who was involved in a sharps injury, with their reactions ranging from the fear of getting in trouble to the uncertainty of the process of reporting, in which one nurse responded, "It's the longest process. Sometimes I think it would be better not to say anything at all." This startled me and showed me that this issue is not only a problem impacting the safety of patients, but goes on to negatively affect the practice and attitudes of nurses, as well as the culture of their workplace. As nurses, we exist as more than half of the healthcare workforce. And, being at the front line of patient care, we also exist as the group of healthcare workers with the highest number of sharps injuries. A team of nurses in an emergency department in the United States introduced a Healthy Workplace initiative to empower nurses to make changes to improve the workplace, creating a healthy work environment for nurses and patients. The initiative brought a tremendously positive changes within the department as staff expressed more interest in making changes due to their involvement in the process. This is an example of how shared leadership within a ward can bring effective positive changes to the workplace culture and consequently the safety of our patients and ourselves. Through a commitment by all nurses, I believe a change can be made to the negative mindsets associated with reporting sharps injuries, and as a result, together we can improve the safety of ourselves and our patients to enhance a healthy workplace. Every year, it's estimated that at least 18,000 Australian healthcare professionals suffer from a sharps injury. Evidence shows approximately 1 in 9 nurses in Australia experience at least one sharps injury every 12 months. The injuries stem from opening vials to recapping needles and heighten the risk of contracting blood-borne pathogens such as hepatitis B, C, and HIV. Despite the current statistics on sharps injuries, there is an emphasis on the word approximately, as it's estimated at least half of these injuries are unreported. To give you an idea, evidence from a randomised control trial conducted by a team in a Swiss university hospital interviewed over 2,000 healthcare professionals and concluded at least 27% of sharps injuries were unreported. This is just one hospital alone. As registered nurses in Australia, we all know it's our responsibility to work within our scope of practice, in accordance to the legal and ethical boundaries. Using documents such as the International Code of Ethics, Standards for Practice, and the Code of Professional Boundaries, we can outline examples of misconduct if we are not reporting sharps injuries. An example of this is Standard 6, found in the NMBA Registered Nurses Standards for Practice. This standard outlines the importance of providing safe, appropriate, and responsive quality care. This standard is then broken down into specific points, such as the registered nurse uses the appropriate processes to identify and report potential and actual risks. Evidently, unreported sharps injuries contradicts this standard, and therefore legal boundaries are being crossed. We all play a significant role in educating each other on safe practice and safe reporting. As previously mentioned, there are currently many actions that are guidelines and resources to assist in reporting sharps injuries. However, I believe it's our role as new graduate nurses to promote the use of these resources, support each other, and implement the foundations for others to follow to change the workplace culture. This is not only because of our legal requirements to promote patient safety, but it also ensures that we, as nurses, are physically and emotionally healthy to work. As a new graduate nurse, I see my responsibility to work professionally, ethically, and legally, asking for assistance and to openly disclose any incidents that may occur. By doing this, I'm practicing safely within my scope of practice and boundaries, providing empathetic patient care and advocating for my patients. With the commitment from all nursing staff, inclusive of AINs to ENs, NUMs and educators, and students that spend time on our ward, we can all play our individual role to reduce the stigma and negative connotations around the process of reporting. I acknowledge that with a variety of experience and educational levels in our ward means there is a number of different learning styles. Therefore, I feel it's important to cater for this and to draw from personal expertise and experience from all of our staff. The importance of mandatory reporting of sharps injuries is further emphasised in documentation such as the Work Health and Safety Blood and Body Substances Occupational Exposure Prevention Guideline. This guideline makes recommendations to involve staff in sharps injury prevention programs, outlining how to identify and report any hazards. There is also a policy directive titled Management of Healthcare Workers Potentially Exposed, which assists staff in the identification and management procedure following exposure. This outlines the management, how to prevent the transmission of further disease, as well as the available support to be accessed, for example, the blood and body fluid exposure hotline. When it comes to improving the quality and safety within the workplace, I believe it stems from the frontline, us nurses. The statistics show that this issue is affecting our patient safety and our workplace culture, and there are policies and guidelines for us to follow. By partaking in this service today, Not only are we conveniently gaining CPD points, which we all know can be hard to manage as nurses are very time poor, but we're also breaking down an important issue, finding ways to improve this issue, and then to move forward in making positive changes to the workplace culture. A team at the University of Florida Hospital reported that hospitals will perform better over time if employees are committed to their jobs and engaged in what they are doing. I hope that this in-service can get the ball rolling to encourage everyone to use their own leadership and be leaders in change, to inspire each other to work towards an enhancement in the safety of our patients and a healthy workplace. Thank you for listening and for your time today, and I hope you all found this very beneficial. If there are any questions, please do not hesitate to ask. Thank you.